the things we've been talking about this semester are examples of what are called wicked problems. A wicked problem is a problem that is incredibly resistant to resolution. We might think of this in contrast to a simple or a tame problem, in which there are clearly identifiable solutions. Most arithmetic problems are tame problems. We know that 2 plus 2 equals 4. Another example might be solving a crossword puzzle. It might take you time to figure it out, but you can be sure there is a correct and knowable answer. But with wicked problems, that's not the case. Wicked problems do not get solved so readily. There is not a clearly defined answer to them. There are numerous examples of wicked problems, all of which tap into some combination of social, political, economic, or environmental realms. We've already covered several examples, including things like racial and gender inequality, corporate crime, the best way to run elections and representation, and even, briefly, educational reform. In the coming weeks, we'll talk about others: healthcare, the economy, climate change. Other examples might include things like immigration, international drug trafficking, nuclear energy and waste, natural hazards, AIDS and HIV. The list goes on and on. Wicked problems have several key hallmarks. As the definition suggests, there is no clearly defined solution. Part of the reason for that is that how we define the problem itself influences the kinds of solutions that might be available. Another reason is that the data we have regarding a wicked problem might be incomplete or perhaps even contestable, and in some cases, it might not even be possible to have complete or fully accurate data. Even when we can identify resolutions to wicked problems, there's no way to test them out in a trial and error sort of way. Each attempt to solve the problem counts. Compound this with the fact that there are often secondary consequences of any possible solution. Most wicked problems are interconnected with multiple arenas, and kind of like tugging at a loose thread in some fabric, doing something in one area will have impacts in other areas. Sometimes we can predict what those impacts will be and attempt to mitigate them, but sometimes they may be unintended and even unexpected. Lastly, each wicked problem is essentially novel and unique. Though wicked problems tap into a variety of arenas, often other wicked problems, each has its own particular set of characteristics. Though we might apply lessons from one wicked problem towards solving similar wicked problems, we still have to remember that there will be distinct hallmarks that characterize one and not another, no matter how similar they may be otherwise. Healthcare has been a pretty contentious issue of late, and regardless of what may happen over the next months, it's likely to continue to be one for some time to come. So, what is it that makes healthcare a wicked problem? Well, let's start with how we define the problem in the first place. What exactly is the problem of healthcare? Perhaps the problem of healthcare is that the quality of coverage just isn't that good. Or perhaps it's that too many people can't afford it. Or perhaps the problem is that the way healthcare is funded costs the government too much. Or maybe the problem is that the requirements we have regarding healthcare represent an unacceptable intrusion into people's lives, such as requiring that all people be covered, or requiring coverage for certain objectionable procedures. Or maybe the problem is that the quality is good, but there aren't enough healthcare providers, so not everyone can access care in a timely manner. These are not the only ways to define this problem, but they represent some of the most common critiques that people have with healthcare in the US today. But what's even more important to notice is that they all place the core problem of healthcare in fundamentally different places. If you think about the problem as primarily about people's ability to afford it, that's going to suggest a very different set of possible solutions than if you think of the problem as primarily about the quality of healthcare that is available. And in fact, if you look closely at some of these framings, some of them suggest fundamentally contradictory solutions to each other. The point here is not to argue that one framing is more right than another, though everyone watching here may have their own opinions about that. Rather, I want you to see that these are some common and indeed valid framings of the problem of healthcare. One key challenge to solving the problem of healthcare is simply in agreeing on what the problem is in the first place. And hopefully you can see what an enormous challenge this first step represents. Another problem concerns the data we have available. The provision of healthcare is an enormously complex system, and it is an incredible challenge for most people to fully comprehend how it all operates. Consider, as a simple example, the CBO scores of the various healthcare alternatives being put forth in Congress over this past summer. These scores provide an estimate of how much a particular plan will cost the government and how many people may gain or lose coverage under the bill. But note that all of these numbers are estimates. Now, the Congressional Budget Office performs a very good faith effort in providing the most reliable information they can, but in the end, they can't definitively predict what these numbers will look like. There are simply too many factors that can't all be definitively and concretely accounted for. This has led to accusations of the reports being inaccurate or misleading. And while those charges are rather politically motivated and often are blown out of proportion, it does suggest that such data are clearly contestable. Or consider an example in which data are not contestable, but are perhaps incomplete. One thing that would help in designing a healthcare delivery system is to be able to know how much a particular procedure will cost. But for a lot of procedures, there is no standard pricing, and different health providers might charge radically different amounts, which generally aren't published. And further, different health insurance carriers may pay radically different amounts for the very same procedure. If you have ever attempted to navigate the details of your insurance plan on your own, you probably have a good idea of the challenge I'm talking about. It's not that these prices are necessarily wrong, but it's difficult to know what to expect with such wide variations and without some mechanism of making these values more readily available to public scrutiny. Even assuming we can gather complete and accurate data and agree on the nature of the problem, there is still no clearly defined solution. Let's pretend, just for a moment, that we all agree that the problem is that healthcare costs people too much, and we can effectively demonstrate that this is the case. Well, what do we do about it? We could simply limit the amount of money that healthcare providers can get for certain procedures. You get cut off after a certain point. Or maybe we could look for ways to train more doctors in the hopes that as supply increases, costs will go down. Or perhaps we focus on early intervention measures. Preventing health problems early on is certainly a good way to avoid expensive procedures for complicated health issues down the road. Or we could move to a single payer model, which would eliminate anyone having to pay out of pocket at all. Note that these are all very different solutions, and they all have different strengths and weaknesses associated with them. Which one is the best solution? Well, we really don't know until we try. Which leads me to the next major point. There is no way to test a solution in a wicked problem. Each attempt to solve the problem matters. Now, we can theorize about it all day long, but until we actually make a proposed change, we don't know exactly what the outcome will be. That doesn't mean we can't have a good guess, but a good guess is still only a guess. Let's compare this to launching a space rocket. Before NASA launches something into space, they test each part of it, the engines, the computers, the doors, everything. And they can take apart these various components and subject them to various trials to be sure they will actually accomplish what they're supposed to accomplish. But it is not possible to do that with healthcare. We can't pull each little part that makes up the healthcare system away from the rest, run some tests on it, and put it back in. It just doesn't work like that. If we take any of the solutions just mentioned a moment ago and try them out, they will have an effect. And though we might change our minds later and reverse course, the effects will still be felt. There will, in other words, be consequences from our actions. Some of those consequences will be what we intend, but some of them may occur in arenas outside of healthcare itself. There are, in other words, what we often call secondary consequences. Consider that in the US, healthcare accounts for about 17% of GDP. Now that's a significant chunk of economic activity. As a simple example of this, consider the growing number of reports of rural hospitals being forced to close their doors. Not only does this mean limited health access in rural communities, in many cases this also means a collapse of a significant economic driver. Anyone who worked for the hospital may now find themselves out of a job. Nearby restaurants may also feel the change, as perhaps people who came there on their lunch breaks or while visiting a loved one just don't anymore. Maybe the hospital used to make donations to community groups. That would be gone too. These other businesses are not a part of the healthcare system, yet they are clearly tied in with things that happen in healthcare. A change in one arena likely means a change in other arenas. Here's another example. When the ACA was passed in 2010, a primary goal of the law was to make healthcare affordable for more people. The actual outcome has been mixed. Plenty of people who previously could not afford health insurance suddenly found themselves able to be covered. So for some, the intent worked out. But other people found their premiums increasing to the point that now some can't afford health insurance at all anymore. Raising premiums was certainly not an intended impact of a law called the Affordable Care Act. And the reasons for this increase are certainly complicated. Nonetheless, it is a material secondary consequence of changes that were made to the system. Of course, secondary consequences are not necessarily all bad things. Part of the ACA included Medicaid expansion, which has actually resulted in positive economic outcomes. On the whole, states that expanded Medicaid have seen budget savings, they have seen revenue gains, and they have seen overall economic growth in their state. Impacts that are driven by but completely outside the actual realm of the healthcare system. And this brings me to our question to look up for this class. Before next class, find out, when did Medicaid become law in the US? Bring that date with you to class. I will be asking you a question about that as we begin. Finally, as with all wicked problems, the issue of healthcare is unique. Sure, there are comparisons we might make, such as thinking about other insurance markets like auto insurance or flood insurance. But even though there may be some similarities, insuring a car is not the same thing as insuring a person's health. The needs and even indeed values are fundamentally different between these things. Even if we were to make a comparison to another wicked problem, such as the economy, which is so closely tied to healthcare, that only gets us so far. The full array of challenges inherent to each arena may overlap at times, for sure, but there are many important aspects of each that simply don't relate to one another. With all the debate around healthcare today, I think it's important to get a basic understanding of how the system works. So that is what we're going to turn to in our next class. We're going to think through some of the various responses and options regarding healthcare. This will include exploring how healthcare works in the US today and how it doesn't work, and comparing the US with our neighbor to the north, the system used in Canada. Stay tuned.